The Federated States of Micronesia is among the top 10 countries with the highest prevalence of diabetes. The World Health Organization reports that 18% of the population is living with diabetes and many more are at risk. This proportion is predicted to more than double within the next 15 years. Pohnpei State is experiencing an epidemic of non-communicable chronic diseases. Type 2 diabetes can lead to painful complications, including blindness, kidney failure, heart attacks, stroke, and lower limb amputation. We can make a difference. There are 3 levels of intervention: primary, secondary, and tertiary. Primary prevention is when we prevent diabetes from happening. Secondary prevention is when we detect, treat, halt, and reverse diabetes. Tertiary prevention is when we soften the impact of ongoing diabetes. Primary prevention is the most important strategy to make Pohnpei healthier. When we prevent diabetes from occurring in the first place by altering unhealthy behaviors before they lead to disease, this is primary prevention. When an early diagnosis of diabetes has occurred and we prevent complications such as diabetic neuropathy, which damages nerve fibers, commonly in legs, feet, hands, and arms, this is a secondary prevention technique. When we manage the disease to prevent complications from worsening, including preventing heart attack, stroke, kidney disease, blindness, and amputation, this is the last or tertiary prevention technique. Pohnpeians can use nutrition, physical activity, and environmental factors to prevent and/or manage their diabetes. Here are some healthy nutrition options to prevent diabetes from occurring. Choose fresh fish rather than canned fish. If choosing canned fish, choose fish canned in water rather than oil to reduce fat intake. Choose local foods such as banana, breadfruit, yam, giant swamp taro, pandanus, and coconut. Reduce fat and calorie intake. Choose a smaller plate to make this easier. Choose water rather than sugary drinks and soda to reduce calorie and sugar intake. Eat more fruits and vegetables. Moving more and getting regular exercise can make a big difference. To help prevent diabetes, we can move more every day. Some ideas include dancing, spearfishing, volleyball, rugby, basketball, and surfing. We can get outside more often and find a buddy or a family member to go with us. We can walk rather than taking a taxi. We can also change our surroundings and make it easier to eat healthy and be more active. This includes growing community gardens, getting outside together, and eating healthy together. By working together, we can help prevent diabetes here at home. Interested in learning more? Here are some resources to find more information online.